For millions of Americans, dysphagia makes something as simple as swallowing a meal feel impossible, but PAM Health is changing that. Their expert speech and language pathologists use personalized therapy and advanced diagnostics to help patients recovering from strokes, Parkinson's, and reclaim their swallowing function and independence. Joining us today on this Wellness Wednesday is speech and language pathologist Megan Smith. Thanks for joining us.
Thank you. Thank you for having me.
You know, we love highlighting PAM Health every single Wednesday, kind of changing gears now because we've kind of talked about PAM really in the broad scale of things, but now we're really dialing in. So what is dysphagia?
So dysphagia is a term that means difficulty swallowing. So it's that sensation you get when things kind of go down the wrong way or when things get stuck as you're eating or drinking.
Which can be so scary.
It can.
And sometimes people, it just comes like essentially out of nowhere, but what can cause this? Or it feels like it could come out of nowhere.
Yeah, so you mentioned a couple: strokes, brain injuries are big ones, Parkinson's and other neurological disorders, but it can also happen with dementia, it can happen with radiation to the head and neck area, or trauma to the head and neck, or when you're in the hospital and you have to get that breathing tube, get intubated, it can damage your vocal cords, and that can also cause dysphagia.
Oh my gosh, again, so scary. I mean, that it should just be a basic need, you know, just wanting to even take a sip of water can be so challenging for someone. And so you are, you know, one of the people that actually helps treat this, but you have a whole team of people that can help with this as well.
Yeah, so speech language pathologists, or SLPs, we're the preferred provider of dysphagia therapy and management. However, like you mentioned, it takes the whole team to be able to identify and then to help carry over those recommendations. So we are able to carry over a lot of the speech language pathologist recommendations from the hospital, and then we just pick up where they left off. But not all of our patients come from the hospital, and it's not always caught in the hospital. And so we're able to do our own evaluations. That may look like giving patients something to eat and drink. We're watching how they chew. We're seeing if there's any food left in their mouth after they're done. And then we're also looking for any coughing or throat clearing, changes to their breathing. And so if we do notice anything kind of abnormal or that would warrant further evaluation, then we're able to schedule something called a modified barium swallow study. So that's a video swallow x-ray. And from there, we're able to pinpoint exactly what is going on, what's causing those symptoms. And then we're able to tailor an exercise program specific to that patient. We're able to make diet recommendations that would lower their risk of what we call aspiration, which is when things go into the airway, or lower their risk of choking as well.
So when you say that, like, does that mean just only eating soft foods? Like, could they ever like eat a steak again, or like a bigger, you know, like bigger pieces of food? Like, how does that work?
That's a great question. So while in the hospital, when there are other medical things going on, often our primary goal in that setting is keeping their risk of choking or of pneumonia as low as possible. But part of our job too is to give patients and their families the information and the tools that they need to make kind of those informed decisions. We know that eating has such an impact on our quality of life. And if somebody told me I'm not allowed to eat a steak again, I'd figure out how to eat a steak again.
Right, exactly.
And so allowing us to be able to communicate how to do things safely in a way that still balances that quality of life while reducing the risk at whatever level the patient is most comfortable with.
Of course, the families are on board with this as well. That's something that PAM Health really strives towards, not only treating the patient, but also treating those families too. So what happens after that patient goes home, after they've gone through a lot of this therapy? How do you really inform the families how to best treat them when they're back at home?
So, as you probably can imagine, dysphagia doesn't just go away the moment you walk out of the hospital. And so, like I said, giving patients and their families that information and those tools to be able to carry over whatever serves them best at home. So we are frequently in contact with family members. We invite them to come to our therapy with us. I love to do meal assessments where we sit down at the table, we have lunch, and from there I'm able to kind of point out, this is something to kind of keep an eye on. This is maybe where you need to say slow down, take smaller bites, but really empowering the family members and the patients themselves to make the choices that best suit them.
Well, it sounds like you are just so passionate about your job, and again, really informing everyone, whether you are the patient or the family, and again, getting them back to what they enjoy, which
Exactly.
is eating the foods that they want to eat.
Exactly.
So what would you say is your why working at PAM Health?
I think, like I said, eating is so central to quality of life. And as speech language pathologists, we also address and treat cognition and cognitive communication. So when I think about what makes us human, it's we eat, we communicate, and we think. And so to be able to help patients achieve those things, they're not as obvious as the walking and the moving around, but they're still so central to us as social beings and our quality of life.
Beautifully said. Well, thank you so much for stopping by today. Again, a lot of people may have this, and they definitely need to get it addressed before other problems arrive. So if you're interested in learning more about PAM Health, just head over to their website, pamhealth.com.